You have likely heard that stress can make your IBS worse. But did you know you can actually use psychological techniques to significantly reduce your bloating? I'm Bimal, founder of Gutsphere, and in this episode, we are going to go beyond diet to explore the powerful connection between your brain and your gut. I will show you science backed strategies from simple relaxation to targeted therapies that can help you finally find lasting relief from that stubborn IBS bloat. Let's get started on this empowering journey. Remember, this information is for general guidance only and should not replace advice from a medical or clinical provider. If you have serious symptoms, please consult a healthcare professional. Okay, let's explore the mind gut link. Why mind and gut are connected. Ever notice how your stomach churns when you're anxious? Or how a stressful event can kick off a round of bloating? That's gut brain axis at work. Our gut has a mini nervous system and it communicates constantly with our central nervous system using hormones, neurotransmitters, and the vagus nerve. Research shows people with IBS often experience visceral hypersensitivity, meaning the gut signals are turned up to the maximum volume. This heightened sensitivity means that even normal digestive processes or slight increases in gas can be perceived as painful or uncomfortable. When we are stressed, anxious, or upset, the gut can tighten or spasm, slowing or speeding digestion in ways that amplify bloating. This isn't all in your head, it's a real physical response. That's why addressing psychological factors can significantly reduce bloating intensity, and in some cases, the frequency of IBS flare ups. So let's break down some evidence based techniques that can help you calm the gut brain loop. I like to call it Stress-IBS cycle. You feel anxious, your gut reacts by bloating or cramping, then you get more stressed because you are bloated. Before you know it, you're stuck in a loop of discomfort and frustration. Breaking this cycle requires more than simply changing your diet. It demands tools that help you interrupt those signals and manage the stress response. For example, let's say you have high pressure job or an upcoming social event you're anxious about. As your stress levels climb, your gut might become more sensitive, leading to increased gas production or altered motility, resulting in noticeable and uncomfortable bloating. If you can learn to dial down the stress through techniques like cognitive behavioral therapy, CBT, gut directed hypnotherapy, or mindful practices, you can short circuit that vicious cycle and give your digestive system a chance to settle. First up is cognitive behavioral therapy or CBT, which can focus on the relationship between our thoughts, emotions, and behavior. In IBS, negative thought patterns like I will never overcome this bloating can heighten anxiety, which then triggers more physical symptoms in your gut. CBT teaches you to identify and reframe these patterns so you can respond to stress differently. So, why CBT works for IBS? By stress reduction. By challenging catastrophic thoughts, I can't function when bloated. You ease your body's stress response. Here are some behavioral adjustments. You might learn to plan gentle yoga breaks or mini breathing sessions when anxiety spikes, preventing a full IBS flare and building a self efficacy. Over time, you realize when you have control over certain triggers, which can reduce the sense of helplessness. So, here is how to start. Seek a therapist trained in CBT, especially one familiar with IBS or chronic pain. You can often find qualified professional through online directories or by asking your doctor for referrals or recommendations. There are some apps or self-guided modules to introduce CBT principles, but personalized guidance often yields better results. And try daily thought checks. If you catch yourself thinking, this bloat is ruining my day, ask if there is a more balanced way to see it. For example, instead of thinking, this bloat will ruin my entire day and I won't be able to do anything, you could try reframing it as this bloat is uncomfortable, but I can still try to engage in some gentle activities and see how I feel. Over time, This reframing can significantly lower IBS-related anxiety. Now let's talk about gut-directed hypnotherapy, which is something that might sound a little out there at first, but there is a solid research behind it. It's a specialized form of hypnosis focusing on the mind-gut link. A trained hypnotherapist guides you into a deeply relaxed state and uses visualizations or suggestions geared toward normalizing bowel function and easing gut sensitivity. These visualizations might involve imagining the digestive system working smoothly and comfortably. Studies have shown promising results, with many IBS patients reporting less pain, fewer bloating episodes, and improved bowel habits. It's not a magic wand, but it can be a powerful complement to dietary changes and other therapies. In essence, hypnotherapy helps retrain how your brain interprets gut signals and how your gut responds to stress. If you are curious, look for a practitioner certified in gut directed protocols or explore reputable audio programs designed specifically for IBS. Not everyone will jump straight into therapy. So let's talk about simpler daily practices you can adopt right now to reduce stress and, by extension, bloating. Number one, deep breathing drills. 4 to 6 technique. Inhale through your nose for 4 seconds, 4 counts, and hold for 2, and exhale through your mouth for a count of 6. Do this for a minute or two whenever you feel tension rising. This activates the parasympathetic nervous system, which promotes relaxation and can help calm gut spasms. Number two, progressive muscle relaxation, PMR. Systematically tense and then release muscle groups, starting from your toes to your face. This helps signal your nervous system to relax. By releasing physical tension, you can also reduce the tension held in your gut. And number three, mindful meditations. Even 5 minutes of a day focusing on the present moment can lower cortisol levels. You can sit comfortably, even close your eyes, and gently bring your attention to your breath. When your mind wanders, guide it back. No judgment. Focusing on the present moment can help detach from the anxious thoughts about bloating and reduce overall stress. You might also explore body scan meditations, which involve bringing mindful awareness to different parts of your body. And number four, journal. Write down what's on your mind, stressors, to-do list, frustrations. Offloading mental clutter can help you feel lighter emotionally, which often translates into a calmer gut. These mini practices may seem basic, but consistency is key. Done daily, they help your nervous system stay balanced, reducing the chance that stress will light up your IBS. Next, let's talk about sleep. Adequate sleep is another often overlooked factor in IBS management. When you are sleep deprived, your hormones spike, you become more prone to anxiety, and the gut can become more reactive. Lack of sleep can disrupt the balance of gut bacteria and increase inflammation, potentially making the gut more sensitive to triggers. So aim for 7 to 9 hours of quality sleep. If stress keeps you up, try adding a wind down routine. Dim the light, avoid electronics for 30 to 60 minutes before bed, and maybe do a quick breathing exercise. Good sleep hygiene isn't glamorous, but it can make all the difference in taming bloating and easing IBS symptoms. You have heard me mention the Gutsphere app for logging meals and symptoms. But did you know you can also track your stress levels, moods, and even sleep quality? Over time, you might see a clear pattern. On high stress days, my bloating hits a 7 out of 10. Or after I sleep for just 5 hours, my IBS flares the next day. Recognizing these triggers help you target the right strategies. Maybe adding a short meditation on high stress mornings or ensuring you prioritize bedtime. For instance, if you consistently notice that bloating is worse on the days you rate your stress as 7 or higher, in the app, you can proactively schedule the relaxation time on those days. The more data you collect, the more effectively you can fine tune your IBS management plan. So, we have covered a range of psychological tools from CBT and gut directed hypnotherapy to daily relaxation hacks, and better sleep. Any one of these alone can help, but together they build a robust defense against stress induced IBS bloating. Remember, IBS is a complex interaction of diet, stress, and individual gut sensitivity. By going beyond diet and focusing on your mind influences your body, you gain a whole new level of control over that stubborn bloat. So, what's next? Experiment with a few mindfulness or relaxation techniques. Consider seeking professional help if anxiety or stress is a major IBS driver. Keep logging experiences in Gutsphere to see which strategies truly make a difference. Remember, consistency is key with these practices. Even small, regular efforts can lead to a significant improvements over time. As you start exploring these different psychological strategies, remember that what works best can vary from person to person. To help you identify your personal triggers and track effectiveness of these packs or tricks or solutions, I encourage you to use the Gutsphere app. It's designed to make it easy to monitor your symptoms and progress over time. Stay tuned for our final masterclass segment, where we will be talking about creating a lasting, holistic solution for IBS bloating, putting everything we have learned into one cohesive plan. Until then, take a deep breath and remember, you've got this.